Hello, everyone. Welcome to our Intro to Level 1 Botox Fillers and TMJ course. This course is going to be taught by Master Injector Dr. Sid Solomon, and the course is being presented for the amazing and impeccable Advanced Dental Institute. This intro is going to be narrated by yours truly, Faye Solomon, and I am Dr. Solomon's course coordinator. So let's see what we have in store for you. Why is this course better than any other Botox fillers and TMJ course you will ever find? That really is the essence of what I would like to get across through this intro. And the best reason to take our course is because we have the only boutique course setting that is designed to fully equip you and get you ready to incorporate Botox fillers and TMJ treatments into your dental offices. Our courses are very small, and that is actually by design. We keep it small so that there can be dedicated one-on-one attention to each and every student. The course includes giving you specific hands-on experience, which will be guided by Dr. Solomon himself, who is a trusted master injector. Our course teaches the best and safest injection techniques because as long as you do the injections as per our guidelines and our guidance, you really should not have too many problems moving forward. And that's one of the greatest appeals of our injection techniques is that they are basically fail-proof. And furthermore, the course doesn't just teach you how to inject, but we take it one level further and we teach you how to market internal and external this service. We teach you how to protect yourself legally. We teach you how to avoid having any problems in the future. And another very important factor is that our courses are provided in a very entertaining, kind of friendly and engaging manner. Dr. Solomon is extremely interesting. And again, the objective of all of this is going to be so that you the student is going to be ready to actually begin injections that Monday when you go back to work. So this course is really a find, and I truly hope that you will be able to join us. Let's go and learn a little bit more. So who is Dr. Solomon, this master injector that I keep speaking about? Just to give you a little bit of the highlights of his career. He's been providing cosmetic and neuromuscular dentistry for 31 years. He has 2 cutting-edge offices in Southern California. He's a best-selling author. Very important to this course and sort of why he teaches this course is because he is actually the inventor of the first and only FDA-approved syringe that was specifically created for Botox. When he started injecting Botox about 8 years ago, he found a very big problem in the Botox venue and in the Botox realm. He decided to solve that problem, and thus was born his syringe, which is called Unitox. Unitox has obtained FDA approval. It is being used across the country internationally as well, and we are very proud of Unitox. Dr. Solomon is a magna cum laude graduate of the University of Southern California over here in Los Angeles. He received his DDS degree from the University of Pacific School of Dentistry. And when he started practicing dentistry, pretty soon he dived into the whole world of neuromuscular dentistry and pathological neuromuscular dentistry, which makes him a very well-respected expert when it has to do with temporomandibular joint issues. And of course, last but not least, he is my very own handsome husband and the father of our 4 children. I'd like to show you this quick video that highlights some of the points I talked about just so you can get a feel for who he is. So here we go. Okay, welcome back. The course is going to be really divided into 3 main parts. The parts are going to be Botox, fillers, and TMJ. And in respect of that division of three different subject areas, I will be keeping this introduction kind of in line with that distinction. So I'm going to be first talking about Botox and the Botox portion of the course, then I'll talk about the fillers and then the TMJ. And of course, these are just very brief intros to give you an idea of what to expect and what to be excited and look forward to. So let's go with Botox as our part one. The biggest question that doctors have as far as why they should even take a Botox course is, how does Botox fit in to the dental setting? Well, the answers are trusted, proven, tried, and honestly, at this point, facts. First of all, there is a very strong trust factor that already exists between a dentist and his patients. Because as we know, dentistry is one of the most invasive doctor visits that the average person will ever have. So they already trust you as their dentist, which is an incredible, important, and relevant factor in ensuring impeccable results, which is that trust factor. The second reason of why having Botox in the dental office is that really Botox is a natural extension of a dental professional's already existing therapeutic and aesthetic abilities. Let's face it, you guys have been injecting in far more difficult places for a very long time. These injections are going to be a piece of cake as long as you know how to inject, how much to inject, and what to do and what not to do. Another great reason is that patients absolutely love to get this service done under one roof. And it just so happens that the timeline for Botox matches and parallels the timelines for dental hygiene. So if your patient is coming in every 3 to 6 months for their hygiene, that's exactly how often they need to come in for Botox. And if they can get their Botox done at the same visit as their dentist, it's just a lifesaver for many of them. The next reason is that really Botox requires much less chair time than your average dental treatment. As Dr. Solomon always loves to say, there is less chair time, less bending, less difficulty, and more production. So who wouldn't want that? And finally, as my personal experience as an office practice coordinator has been, patients absolutely love to come in for Botox. So we're all used to hearing patients not be that excited to come and get a crown or a filling or, oh, now I have to come in for my this or that when it comes to dentistry. But when it comes to Botox, they appreciate and thank you for giving them the opportunity to come in and get the treatment done. They call and they have a party to go to or an event, and they really want to come in. So it's obviously easier to schedule Botox sometimes than it is for more invasive dental procedures, and you may actually have the same production with less chair time at the end of the day. So when someone asks you, why do you want to take a Botox class, you should really say, why not? I mean, there's many, many more reasons why you should be taking it than why you shouldn't be. Speaking of these reasons, apart from providing a very needed service to many of your patients, at the end of the day, it has to come down to ROI and what's going to be your return on investment. And is it worth it for you to take this class as far as how it will help you raise production in your practices? This is an example of the possible production that you can have from Botox and fillers. And the reason it's relevant is because it can be ginormous. If you're looking at a possible production from Botox at approximately $1,500 a day, you can easily achieve this $1,500 from, say, 2 Botox patients and 1 filler patient. You don't need that many patients to reach a $1,500 production. If you can do that a couple days a week, imagine doing that every month, and imagine doing that every year for a whopping 288,000 increase in production. If we deduct 50% of that, which could be the cost of product, because Botox is expensive, but the beauty about it is that That's all you need. You don't need a big a big machine, and you don't need to invest in a lot of other products. It's just the little vial of Botox, but of course it is expensive. It's liquid gold. And so if you take out that cost of product, you're looking at a yearly net of potentially 144,000. So spend 3 days of your life, learn Botox fillers and TMJ from a master instructor, learn how to do it right, learn how to do it in a way that you're not going to have problems, and add approximately $150,000 increase to your yearly production. It's a no-brainer, and really it's something that every dentist should incorporate in their dental offices. Talking about your dental offices and using botulinum toxin. By the way, botulinum toxin, as you'll learn in the course, is the correct and the actual product name for Botox. Botox is a brand name similar to Kleenex, how Kleenex became the brand name that was used to associate all tissue papers. Botox is also the brand name that is used to associate all botulinum toxins. But of course, it fights very hard to keep its market share, which is its ability to use the word Botox. And by saying it, I'm referring to Allergan, the company that makes Botox. But you will learn all about products and etc. during the course. But just to give you a very broad idea of why Botox and fillers fit seamlessly into a dental office, you can use them for temporomandibular disorders. You can use Botox, of course, as we all have heard, for bruxism. Botox is actually FDA approved as a frontline headache and migraine treatment. You can use Botox for treating facial pain. Another way is when you have done that full set of dental veneers and now you have the most beautiful smile, you could really use fillers to establish proper smile lines and lip lines for that patient. You can use fillers for black triangles in between the dentition. And finally, you can use Botox to treat the gummy smile. Now, these are just some general ways. Botox has FDA approval for many specific areas. We'll go through all of that in the course, but there are also non-FDA approved uses of Botox, which are completely legal and kosher. But again, these are all the details that you'll be learning in our course. So let's go on. When we speak about the course and when we speak about what you're going to learn, a lot of doctors are hesitant to take this course because they just don't know how Botox fits into the scope of dentistry. Well, we teach you specifically how to inject Botox within the scope of dentistry. So we take away all the guesswork, we take away all the potential pitfalls, we address them head on. We teach you how to inject properly. We teach you how to inject within the scope of dentistry. And depending on the state you're in, it's a foolproof method. Each state is different. And so you will have to check with your own state dental board to see the amount of room they give you as far as using Botox in your dental offices and what your limitations, if any, would be. More and more states are becoming more and more modern, and they are agreeing that Botox does have a very viable place as one of the many other treatments that dentists provide in the dental office. But of course, there are still some states which do not agree. Again, you will have to check with your own state board to make sure about your own state's details and guidelines. But in order to keep it safe for everyone, we simply teach you how to do it within the scope of dentistry so that there are no issues. So let's talk a little bit about what you're going to learn. And when it comes to Botox, one of the greatest things that you need to learn is we have some pictures of different products that are different types of toxins or botulinum toxins, different contenders. There's Botox, there's Dysport, there's Xeomin, there's Jeuveau. We're going to go over all of that with you, and we're going to teach you exactly what product is better for what area or what product has the biggest market share, but our focus is generally going to be Botox. I want to tell you just a very brief outline of what the course will include. So I just talked about product selection. So you're really going to learn, and you're going to be very skilled, and you're going to get the verbiage as far as what each of these products are known for and what is the best product at each time. You're going to learn about product reconstitution. So Botox, for example, comes in an invisible, powder that you then have to reconstitute and make into a liquid form that you will then inject. Well, we teach you the best way to reconstitute Botox. We teach you exactly how the product works. It's very important for you to understand what this product is going to do when it's injected, so that you can explain that to the patient, so that you can be in charge of what the product is doing and where it's going. Very important is that we teach you specific facial anatomy. So you're going to go back to your old days in dental school, and you're going to touch up on all your facial anatomy skills. Finally, after that, we're going to get into it, and we're going to teach you how to inject. Learning the proper injection techniques is absolutely key. I can't stop saying it enough, because if you inject the right way, you're not going to have any problems. And there are ways of injecting the right way. So we're going to be teaching you injection techniques that have passed many tests and that are basically foolproof. Doing this, by the way, with our syringe, which is Unitox, the syringe that Dr. Solomon has invented, that helps also ensure accuracy and precision with every injection, and also helps you get the best results. We're going to go over the do's and don'ts. We're going to go over everything that you really should be doing and everything that you shouldn't. We're going to go over A to Z, the ideal patient consultation visit. So what do you want to look for in the right patient to do this for? What do you want to ask them? What do you need to know about this patient? What are their desired results? How are you going to under promise and over deliver, ensuring for, a very satisfactory result? So we're going to really teach you a lot of important elements that are basically gathered by not just the literature that's out there, but our own hands-on experience that'll help you make the difference of being an average Botox injector to an expert Botox injector. Another thing is we're going to teach you marketing. So you're going to learn not only how to internally market the product, but also externally. So adding Botox fillers and TMJ treatment is just like the day when you maybe added implants to your array of services that you provided. It is just another service that you provide to your patients, but it can't be dormant. You have to get the word out, and we will teach you how to internally and externally do that. Finally, we're going to go over the consent forms and all other legal forms that are needed in order to protect you fully. There is so much that can be done and that needs to be done in this realm. And just like we have our dental consent forms for all of our dental procedures, there are very specific consent forms for these procedures, which we have formulated for you by our own legal departments. And we give them to you as a suggestion. Of course, you're able to modify them, do anything you want with them, and do all your own due diligence as far as what you would like to present out there for your patients. But these are very good forms, and we'll give them to you in both paper and downloadable formats so that you can customize them to your own office and use them.
If this sounds like it could work for you, I encourage you to sign up as soon as possible, because as I've explained, our courses are boutique size in nature, and therefore they are very limited in the amount of space and availability for attendees. Please contact advanceddentalce.org or simply call 702-906-5802. And the staff at Advanced Dental CE